So Aristotle was born in 384 BC in Macedonia. He was tutor to Alex the Great. He also worked with Plato in Athens, Greece, and he was one of those guys that went by, he was famous and went by the one name, like Pele, the soccer star. He was known as the Master. Aristotle was one of the first to look at what makes people happy. He found that successful, good people all possess distinct virtues, and this is what led him to come up with the virtue theory. Virtue theory is based on 10 individual characteristics or character traits, and they include courage, temperance, liberty, magnificence, magnanimity, pride, patience, wittiness, friendliness, and modesty. Aristotle proposed that all virtues hang in between two vices, kind of like a seesaw or a teeter-totter. So at one end of the seesaw, you have cowardice or decreased courage. And then at the other end, you have recklessness or rashness, which is probably too much courage. But in between these extremes, you have the golden mean, or the sweet spot, and that's where the brave, virtuous, courageous person would be most of the time. The virtue of modesty, again, at one end, you have self-deprecation, or always putting yourself down. On the other end, you have the boastful person who talks about themselves all the time. So in that happy place or sweet spot or middle, you would have the truthfulness about yourself, or modesty, and that again is the golden mean, or the middle. So we must ask ourselves, how do we become morally good? Aristotle says that we are what we repeatedly do, meaning excellence is not an act, but rather a habit. So we must practice and we must work at it. He also proposes that we use moral exemplars to look up to learn from. So for example, Mother Teresa, Gandhi, Martin Luther King. These are people with very high virtues who can teach us and guide us to become more virtuous and live our life to be more virtuous. And with that, I'm going to send it to MJ.
Today we're going to talk about Eudaimonia. So Eudaimonia is an ancient Greek word which roughly translates in English to human flourishing. So if we take a look at Eudaimonia, eu meaning good, and daimon means spirit. So with Aristotle, we're driven to be our best selves in our everyday lives. Now when we take a look at Eudaimonia, if we try to reach our best selves in every moment, then we can be fulfilled in life. So let me talk to you guys about what brings me a little Eudaimonia, and maybe it can help you as well. So what brings me eudaimonia? It's this. It's connecting with nature and taking the time to meditate and go within every day. So you can create eudaimonia every day too. You can do it a number of ways: by volunteering, giving to those in need, expressing gratitude, carefully listening to others, and also by persevering at your goals in spite of any obstacles. So kind of think of eudaimonia as sort of living your best life. Remember, people can feel your energy. They know when you're living your best life too. So when you're a nurse and you're in the hospital, create that eudaimonia to create a bond and feeling of trust with your patients.
So, what exactly is virtue ethics? It's everything that moves from potential to actuality. It's the character development which allows you to actualize your highest good. It's something that you can only learn through experience. And one vital point about virtue ethics is the golden mean. Let's talk about the golden mean. Golden mean is the right action between two extremes, that being excess and deficiency. So example of this would be courageous. Courageous is the midpoint between two extremes. And to get my point across, I'll list some help. We have an individual coming out of a convenience store, gas station, whatever it may be. This individual sees another individual get beat up. Right? So somebody who's not in virtue will try to actually interject into the situation, possibly get beat up as well. So somebody who is in virtue, the first thing that this individual should have done is to assess the situation. Now, remember earlier when I said that courageous is the midpoint between two extremes? Well, those two extremes are recklessness and cowardness. So what we just saw from this individual is recklessness, not courageous. The courageous thing he should have done is to call the authorities to interject for him. Now let's say if this individual is somebody who's bigger. So obviously, this individual is bigger, probably stronger, and if he was in virtue, he would have assessed the situation and realized this individual is smaller, far weaker. Now, if he can safely interject the situation and diffuse it, help, whatever, safely, that would be the courageous thing to do. Let's say if he can interject safely but chose not to, that would be considered cowardice.
Oh, hey, didn't see you there. So, I wanted to go ahead and go over some of the characteristics that one should have in order to fulfill virtue ethics, and I'm going to name 5. So, it's honesty, compassion, generosity, fidelity, and fairness. Okay, so when given examples of virtue ethics, the first one that we're going to talk about is honesty. All right, so you want to be honest with your patient 100% of the time. Honesty is the best policy, okay? So this comes very important when we're talking about confused patients, okay? A confused patient can go ahead and presume that you are someone that you are not. It's important not to play a role of something other than just the nurse. Be very generous with your care, right? The more generous you are when caring for the patient, the less you'll have to come back to that patient. You're supposed to do hourly rounding, so I believe that when you round, you want to go ahead and cluster all the data that you need. You want to go ahead and perform those 5 Ps like they do at Advent Health, right? So you want to gather all the information necessary before leaving that room and being generous with your care, so that way the patient doesn't have to continue calling you hour by hour, minute by minute, second by second. So compassion plays a big role in nursing, okay? Every nurse should be compassionate when it comes to patient care, okay? The more compassionate you are, the better day you're gonna have, in my opinion, okay? You have to commit actions because you want to, not because you're forced to, okay? Nursing and compassion go hand in hand, right? You have to do things because in your heart, you feel that it's the right thing to do. Okay, so the 4th characteristic is fidelity, okay? If you say that you're gonna do something, do it, okay? Because a lot of the times, you know, nurses might say, oh yeah, I'm gonna do this for you, you know, and I understand that sometimes the patient load is a bit larger than other floors, but make sure that if you tell a patient that you're gonna do something, do that for that patient, okay? Write it down, make a checklist, okay? Don't forget about it, because at the end of the day, the patient is only thinking of himself because, I mean, it's only one person, right? And I understand that sometimes we have more than one patient, but that patient's still waiting for that request, so it's important to fulfill that request. Okay, lastly, we'll talk about being fair to your patient, okay? Sometimes we'll have a patient who's being super difficult, okay? But just because that patient's being difficult doesn't mean that we treat them any differently, okay? We have to remember that a patient who is in pain is subjective, right? We can't say, oh, that patient's not really having pain, because maybe we went through something similar like that, and maybe we didn't have pain when that patient had that specific problem, okay? We all tolerate pain just a little bit differently, so it's important to be fair to that patient and not judge the patient in any of his or her care. So in order to achieve virtue ethics, one must achieve their highest possible good. Okay, so we talked about 5 characteristics that had to do with virtue ethics, and there's many more. I just chose those 5 just to give examples, okay? So we literally, as nurses, can achieve virtue ethics every day by just doing the right thing. So you don't achieve your highest good by just doing what you're supposed to do, okay? you need to learn how to go above and beyond, not only for your patients, but for your coworkers that are working with you as well, okay? And some of the things that we can do is we can help our coworkers or our colleagues' patients without them having to ask for assistance, okay? It takes minutes to answer a call light, okay? You can answer a call light and the patient can say, hey, I need help with opening up my juice, or could you cut this meat for me, okay? Would you be achieving virtue ethics by calling that nurse to come do that job, or by calling that tech to do that job? Are you doing the best that you possibly could be doing? Every day that you're working as a nurse or in the hospital setting and dealing with patients, go ahead and reach that eudaimonia, okay? Reach that highest possible good and go home knowing that you did the best that you could, all right? Go ahead and be that shining star.